Hi there, it's Beth Wills, and I'm doing my wound assessment video. Before we begin, I would like to mention that I would do hand hygiene, and I would go to the chart first. I would look at the physician's orders and notice our patient's name is Vic Sear. His date of birth is December 2nd, 1967. His doctor is Dr. Carlson. He has allergies to Tylenol number 3. It gives him hives. His diagnosis is diabetes with query staph infection. And the doctor's orders say to cleanse, irrigate, and pack the wound using normal saline once a day and as needed. To pack the wound using normal saline soaked 1/2 inch packing strips. He's allowed activity as tolerated, and we're to assess his vital signs every 8 hours. So before I do anything, I'm going to go out of the room. I'm going to introduce myself to the patient, do some hand hygiene, identify the patient, and then we'll get going. So I'm going to do some hand hygiene. Hello, Mr. Sear. My name is Beth Wills. I'm an LPN, and I will be doing your wound dressing. We will be changing the packing, and we will be dressing the wound. So before we begin, I just would like to identify that it's you. I'm just going to look at your armband. Could you please tell me your name, your full name? Vic Sear. Great. And your date of birth, Mr. Sear? December 2nd, 1967. Okay, that's great. And your doctor is? Dr. Carlson. Great. Do you have any allergies, Mr. Sear? I noticed you have an allergy band. You're allergic to Tylenol number 3. Okay, and what does that do? It gives you hives. Okay, well, we'll be sure not to give you any Tylenol number 3 for pain at all. While we're on allergies, do you have any other medication allergies or allergies to latex, tape, any type of gloves, any kind of dressings, anything like that? No? None at all? Okay, no other allergies whatsoever? Okay, great. Okay, well, the reason why we're doing this procedure today is obviously we want to promote wound healing from the inside out, decrease infection, and also we obviously have an order to change your dressing. Have you ever had wound packing done before in the past? Oh, great. Okay, how did it go? Was it okay? Great. Okay, and on a pain scale, I'm just wondering, where's your pain level right now? Okay, it's at a 2 or 3. Okay, well, that's great. That's normal. That's what we would expect. If it increases above that, just let us know, please. We don't want you to be in pain, obviously, during this procedure. Okay, so I'm going to do a couple things now. I'm going to pull the curtain for privacy. I'm going to raise the bed and the bed rail. I'm going to reposition you to make sure you're in a good position. Okay, everything's great. Okay, great. Also, I should educate you on when we're finished the procedure, please be on the lookout for any signs of infection, and that could be like redness, edema, any purulent drainage, any raising of the area, anything unusual. If you feel any kind of loss in the area, please report that to us, and just be cognizant because we don't want any infection after the procedure. Okay, great. Okay, the first thing I'm going to do is I'm just going to put on my clean gloves here, Mr. Sear.
Yeah, it's okay.
Great. Just beautiful. The first thing we're going to do, Mr. Sear, is we're just going to remove your old dressing. I'm just going to loosen the tape up here first. And we're going to pull it away from you to reduce any chance of infection, and also just so that we don't hurt you or shock you. We're going to look at the dressing itself that we removed to see if there's any drainage, the type of the drainage, the amount of the drainage, the color of the drainage, and any odor to the drainage. And there isn't. So we can put this in our garbage. Okay, the next thing we're going to do is we're just going to look at the wound itself. We're going to assess it for any redness, maceration, swelling, edema, anything unusual at all. We see it's packing. We're going to palpate around the areas that show some wound healing. We're going to check the temperature of the skin as well. Okay. We're going to look and observe to see there's packing, how deep it is, and what we're doing with the wound. Okay, that's great. Good. Okay, so we're just going to remove the gloves here. Okay, and the next thing we're going to do is we're going to check our sterile tray. We're going to make sure it's not expired, there's no breaks, there's no rips, the tray itself is in good condition, and everything is okay with the tray. And then we're going to pull it away from us. The forceps are in a good position here. They're on the top of the drape. If they weren't, we'd have to ring our call bell and ask our coworker to get us another pair of forceps. But they're in a good condition, so we can pick them up in our hands here. Okay. Next, we can take the drape out of the package here. Okay. Keeping in mind that it's okay to touch 1 inch of the margins of the drape, but only 1 inch. And that's it. Okay. And there's our sterile drape. We can now put things on our sterile drape if we want. So we will take our forceps.
Take it.
Them down. We'll put a couple of 2x2s down. Keeping in mind there's a 1 inch margin around the drape, so we can't put anything outside of the 1 inch margin. Keeping our tips down as we do this. Great. Okay, we can put this on the drape, but we have to ensure that the tips stay here. Okay, now that we've done this, we can actually open our packages and put things on the sterile drape. I must mention that unfortunately I got the package that I had to open, so we kind of have to open them and do this, unfortunately, and I'll step back and I will take the sponges out of the package. Okay. And we will put them in the garbage. I will step back, take the sponges out of the package, put them in the garbage. I will step back. Okay. Now we can open our scissors as well.
Bro, her middle name's not Deborah.
Okay, this can go in the garbage. After that, okay, we can step back and we can open our syringe. Down in our sterile field as well. And the garbage. Back. We can open our ABB pad here. Open up the package. Our ABB pad in our sterile field. And garbage. And we can take our packing, open that up, put that in our sterile field. Garbage. And finally, our irrigation tip. We can open that and put that in our field. Now, unfortunately, the irrigation tip fell out of the package and it is not sterile, so we would ring the call bell. We would ask somebody to go get us another irrigation tip. Okay, somebody has gotten us a new irrigation tip, and now we have everything on our sterile tray. And now we can check our saline. We can notice that it's not been opened. There's no date on it. It's a brand new saline. So we can actually pour some in the package, keeping in mind that we don't want to corrupt the cap or the bottom of the saline. Okay, that's great. And now we can get rid of the saline. Okay. The next thing that we can do is we can now put on our gloves again. Keeping in mind we're not putting our back to our sterile field at all. We're standing right in front of our sterile field, as we don't want to contaminate it at all. We'll take our other glove here. Those are a little small and a little hard to work with, but we're making it work. Okay, great. And now what we can do is we can actually take our forceps and we can remove the packing from the wound. Okay, and we can put that and the forceps in the garbage. Okay. We can now take our clean gloves off, or dirty gloves off, I should say, and put them in the garbage. Okay. So the next thing we're going to do is we are going to put on our sterile gloves. So we're just going to move down here again. Clean the seal film line. Okay, this is the package of our sterile gloves.
Everyone's looking the other way.
Only pull on the outside and pinch the edges to open the package.
See, I just got nothing to lose, so.
There you go.
I got
They're
nothing.
okay because we're just touching the outside of the package. Like this.
What is it?
Great. Okay. So what we can do now is we can reach for the inside of the glove only.
Literally another.
And we can put
Yeah, but it's not my
it
charge. I'm not just
inside
taking
of
someone's
the glove.
charge or anything.
Once we get our hand inside of the glove, we can
You
take the
gotta fix
glove.
your charge.
By the way, if
gotta unlock my
the
phone.
people went back like that, it would contaminate the whole package, and we would have to get another pair of gloves and start again. So now that we have our sterile gloves on, we can just move our fingers and ensure that they're. And like I said, by the way, when that flap came over, we would have to get an entire new package of sterile gloves to start the procedure. Okay, so now we're completely sterile. We can touch whatever we want in this field, keeping in mind that again there's a 1 inch border, so we can just move our stuff around here. Keeping in mind we have to be cognizant of the 1 inch border. Okay. So we're going to take our irrigation tube and we're just going to connect it. Okay. We're going to draw up some saline here. Okay. And the first thing we're going to do is we're going to clean the wound. So I'm going to simulate it. So we would be 1 inch from the wound, top to bottom. And we would just make sure that we irrigated the wound. This is to take care of any maceration that might be on the wound or anything like that. And we haven't touched the wound, so this is still sterile and everything is okay there. So we can actually come back over here too and get rid of our irrigation tip, back the garbage, and that would be great. So now that we've irrigated that, the next thing would be is we are going to clean the wound. So we'll take some 2x2s and seal in here. So the first thing we're going to do is we're just going to clean around the outside of the wound. So 1 swipe, keeping the tips down, garbage. Second swipe, and this will be on the outside, keeping the tips down, garbage.
Stuck in the heat.
Great. And now what we
You
can
can't
do
need it.
is
25 cents.
do the bottom.
Is this a fast charger?
And then tips down. So inside, 1 swipe, garbage. Outside, 1 swipe, garbage. Great. Now the next thing we can do is we can actually draw the wound.
Is she my wife?
And tips down, so
Yo,
1
yo, yo, yo.
swipe, garbage.
Hey,
Okay.
compliment. Bro, you got
And
rid
1
of
swipe, garbage. Okay. So now our wound is cleaned, our wound is dried. And so the next thing that we have to do is we actually have to put our packet and repack it. So we're going to guesstimate how much packing we would need here. And give it a cut. And then we can just take it and drop it into the saline.
Bro, Bro, Tate, they can look at Preep's Riz. Preep Riz now.
We'll just let it sit there for a bit.
Bro,
We
she might be
can
a
just
mom.
bring it up and we can get rid of the excess saline here.
This is eyes.
Get rid of as much as we can. Okay, so what we can do is we can now put this in our hand since we're sterile. We can leave a okay, and we can pull the tail out. Okay, and we can just put this in our hand. Okay, and we can take and we can put this in the wound, making sure and careful not to touch the wound itself. Okay, and we're going back and forth in an accordion position to make sure that the wound is packed. And we can
Yeah.
leave a little bit of a tail out there. Okay, so now the wound is packed. We've done everything we need to do for the wound. So we could take some
Actually, no, she bit.
4x4s and put it over the wound. Okay, once we do that, the sterile technique is finished. So we can take off the gloves.
Roadie. No, on that. No, I'm giving you advice.
Take the ABD pad
No. If you put prison.
and we can put it over the wound. Okay, we can now tape the wound. And window taping. Tape like this. And this. Okay, great. And then just across here. And across here, which is great. And then one more time. Here and across here. And then finally what we're going to do is we're going to take our pen and we're going to write the date. We're going to write the time. We're going to write our initials and we're going to put that on the wound here. Okay, great. And the final thing we're going to do is we're going to reassess the patient for pain to see if he needs any pain medication. We're going to do our safety protocol and ensure the call bell's in reach. The bed is lowered, the patient is comfortable. We're going to ask if the patient had any questions about the procedure at all. And that will be the end of the video.